Spinal decompression therapy is often recommended for conditions like herniated discs and sciatica, but many patients ask the same question: what actually happens inside the spine during the treatment? Because the mechanism is surprisingly simple once you understand the physics behind it. Your spinal discs act like cushions between vertebrae. Inside each disc is a soft gel-like center. When pressure builds inside the disc, that material can push outward and irritate nearby nerves. Imagine a sponge underwater. When you squeeze it tightly, fluid is forced out. When you release the pressure, the sponge slowly draws water back in. Your discs respond to pressure changes in a similar way. Spinal decompression gently stretches the spine in controlled cycles, not aggressively, not forcefully, but in a very precise, gradual way. As the spine is stretched, space between the vertebrae slightly increases, and this creates something important: temporary negative pressure inside the disc. Now, this idea of negative pressure is key because when pressure inside the disc decreases, two important things may happen. First, it can help reduce pressure on nearby nerves. This may reduce symptoms such as pain or tingling. Second, it may allow the disc to draw in fluid, oxygen, and nutrients. And that's important because discs don't have a strong blood supply. They rely on changes in movement and pressure to stay healthy. So instead of thinking of decompression as something that pushes a disc back in, it may be more accurate to think of it as creating the right environment for the body to respond. This is an important distinction. Spinal decompression does not forcibly reposition a disc. It doesn't instantly fix structural changes. And it's not a one-time solution. What it does is influence the mechanics and pressure within the spine. And in some cases, that change in environment can support the body's natural healing processes. Now, not every patient responds the same way, and that's because spinal conditions are complex. Factors like severity of the disc injury, duration of symptoms, overall spinal health, movement patterns, all play a role. That's why decompression is often combined with other approaches, like strengthening, posture correction, and mobility work. So if we go back to the original question, what actually happens inside your spine during decompression? It comes down to this: the treatment changes pressure inside the disc, and that shift in pressure may help reduce nerve irritation and support recovery. Understanding the mechanics behind treatments like spinal decompression can help patients make more informed decisions about their care. Because when you understand what's happening inside your body, treatment becomes less mysterious and more intentional. And that's often where better outcomes begin.